Hello, this is Dr. Gay from First Look MRI, and this is a patient who had an ACL tear, and they also had some fluid in the back of the knee, and it turned out that I believe this to be a plantaris muscle rupture. Pretty rare thing, don't see it very often, and originally I used to struggle pretty hard, and still do sometimes when I see these, because it's not a muscle you commonly can visualize, and when it's torn it's hard to tell. So here we go. This is a good example where you can actually see the tear. And I'm going to start off with a side view here. This is just a bread and butter ACL tear. This is the ACL. You can see it wavy here. It's torn near the femoral attachment. There's the femur, patella, tibia down below. So ruptured ACL, bread and butter. Here's the lateral meniscus. Looks really good. We see a prominent terminal sulcus contusion, and it's impacted by a little over 3 millimeters. And a little contusion in the posterior lateral corner there. Now they had a kind of a typical tear. Patients with ACL tears get a peripheral rim tear in the posterior horn of the medial meniscus. They have a little peripheral tear near the rim, and they even had a little fragment here that's displaced outwards. Here is the semimembranosus coming down, and that little fragment's right in front of the semimembranosus attachment. So if we look back here, something is unusual in this case. All this fluid down here. So the question is, do they have a ruptured joint capsule back here that's letting fluid come out? Maybe so, that may be part of it. But as we start down low and go up the calf, we see this fluid back here, and it's so well contained, and there's so much of it down here. And again, it could be extravasated fluid, but as we come on up, we start to think about, well, how about that plantaris muscle rupture? So the plantaris, when it does rupture, a lot of times it'll bleed, and the bleeding is right in here. This is the typical location. So we have the gastrocnemius muscles over here, and we don't see the soleus. We're above the soleus. Let's go down to that. So we're going to go down, down, down to find the soleus. So here's the soleus. It comes right off the back of the fibula right here, this broad area right here. And so we're above that pretty significantly. Again, we have the medial lateral gastrocnemius muscles, and we have this extra thing right here. You say, wait a minute, that's not the gastrocnemius. What is this thing? Well, that is the plantaris. It comes down here, and it turns into the little tendon here. So the tendon is surrounded by hemorrhage, and we're coming on up, and now we start to get into the juicy muscle here. As we come on up, the muscle's looking a little unhappy. If we keep on coming up, it gets strained to here, and then we don't really see it above here, near the proximal attachment. So it looks as though the plantaris is torn, and there's that hemorrhage associated with it all in this space that is, again, in front of the gastrocnemius muscles and behind the popliteus muscle. And that's it. So a plantaris muscle tear with associated hemorrhage in the posterior calf. And again, some of this stuff could be related to a tear of the posterior joint capsule for sure, but there's rare cases where you can actually see the muscle and see the blood products surrounding it and surrounding that tendon down below. Anyway, thank you very much.